What is bowel cancer? Bowel cancer is an oncological condition in which a malignant tumor forms in the sections of the small or large intestine. This type of cancer is considered one of the most common. Approximately 10 out of 100,000 people are affected by this condition. It is more commonly diagnosed in men, ranking second after lung cancer, and somewhat less frequently in women, following breast and cervical cancer in terms of frequency. Watch the video to the end, as at the end of the video, survival statistics for different stages of bowel cancer will be shown. This prevalence is associated with the difficulties of early diagnosis. The human intestine is characterized by its considerable length, and a tumor can develop anywhere within it. Malignant transformation more often affects the epithelial cells of the large intestine. In its natural folds, there is a regular accumulation of fecal matter, trauma to the membranes, exposure to harmful substances, which are predisposing factors. Bowel cancer develops in several stages. The most favorable prognoses are for patients diagnosed with a tumor at stage 0 or stage 1. Stage 0 is characterized by only dysplasia and active cell division. At this stage, they are not yet malignant, but become so in approximately 1/3 of cases. In stage 1, symptoms are completely absent because the tumor is still too small, not compressing surrounding structures, and only affecting the superficial layers of the intestinal walls. At this time, the patient may notice increased frequency of bowel movements. From stage 2 onwards, deep infiltration of the tumor is observed, with possible metastasis. The clinical picture is pronounced, but often attributed to other diseases. Patients often try to treat themselves with folk remedies. In stages 3 and 4, the tumor sizes are considerable. Intestinal obstruction is possible. Adjacent organs are affected. Atypical cells reach the lymph nodes and may be found throughout the body. However, specialists have managed to identify several main factors that provoke the development of pathology in the intestines. These include family history. If close relatives have been diagnosed with bowel cancer, the entire family is at risk. Personal history. The presence of benign formations in the intestines and inflammatory bowel diseases in the medical history increases the risk of recurrence and further mutation of affected areas into malignant tumors. Obesity. The risk of developing the disease is higher in people with a body mass index above 30. Unhealthy diet. High rates of morbidity are noted among people who consume low amounts of fiber and high amounts of fats. Dietary fibers cleanse the intestines, absorb carcinogens, and also have a beneficial effect on the formation of fecal matter and their transit speed through all sections of the intestine. Semi-finished products, red meat, and high-fat foods contribute to the growth of stem cells, from which tumor areas subsequently form. Low physical activity, lack of movement negatively affects intestinal motility, leading to stool stagnation, constipation, and damage to the mucous membrane. Smoking, alcohol consumption, carcinogenic substances contained in alcoholic beverages and smoking mixtures provoke the transformation of healthy cells into malignant ones. The first and recognizable symptoms of bowel cancer are markers of body intoxication. It develops against the backdrop of tumor, tissue growth, and the immune response to the spread of malignant cells. Simultaneously, changes in digestion are noticeable. A group of symptoms arises, among which the first signs of malignancy in the process are mild, dull abdominal pain, abdominal bloating, dark-colored stool or stool with blood streaks and abundant mucus, general daily weakness even after minimal activity, nausea, unexplained weight loss without changes in diet and activity level, changes in food preferences, including aversion to meat dishes and usual foods. The cancerous tumor continues to grow, and as it grows, clinical symptoms become more pronounced. Here, primary symptoms are accompanied by intense and frequent colicky pain every 15-20 minutes, enlarged asymmetrical abdomen, increasing vomiting after eating, alternating constipation with profuse diarrhea. Stool with traces of blood. Infrequent but requiring urgent measures, signs of intestinal obstruction. If a large tumor blocks the lumen of the intestine, its walls begin to stretch. blood circulation is disrupted in them. In advanced cases, mucosal necrosis and peritoneal inflammation occur. Peritonitis develops. Prevention of bowel cancer. To prevent the development of bowel cancer, it is necessary to maintain a healthy lifestyle and undergo regular screenings, which allow the detection of malignant neoplasms at early stages. When the disease responds well to therapy and the prognosis is maximally favorable, people over 40 years old are recommended to regularly test for occult blood in the stool and undergo digital rectal examination. After reaching the age of 50, it is necessary to undergo colonoscopy every 2 to 3 years, as the risk of developing colorectal cancer increases with age. If close relatives have been diagnosed with this disease, it is worth scheduling a consultation with a geneticist and undergoing genetic testing to assess the risk of developing bowel cancer due to hereditary factors. To maintain normal bowel function, it is recommended to quit smoking and alcohol, engage in regular physical activity, include an adequate amount of vegetables, fruits, and greens in the diet, and reduce the consumption of red meat, sausages, processed meats, trans fats. The 5-year survival prognosis for bowel cancer is, at the first stage of the disease, up to 95%, at the second stage, up to 90%, at the third stage, from 55 to 70%, at the fourth stage, around 30%.